All right, welcome to another episode of the Filipinx AO Sharing Stories Together, or PSS podcast. Today is May 26, 2021, and this here is episode 3, Understanding of Mental Health Through Self-Care and Community Care During COVID-19. Now, here's a disclaimer. Information is up to date as of today's recording, live stream, as I mentioned, May 26, 2021. But due to the circumstances surrounding COVID-19, information may have changed by the time you view this episode. Well, so as for introductions, my name is Eddy Gana Jr. My pronouns are they, them, and I am part of Fil-CHA. What is Fil-CHA? Well, Fil-CHA is Filipinx AO Community Health Association, and we were formerly called the Filipinx AO COVID-19 Resource and Response Team, but you can just call us Fil-CHA. And our goal is to address the health disparities within the Filipinx AO community and provide policy recommendations and resources surrounding the needs of the community. We aspire to serve as a network for our community through collaboration between Filipinx AO scholars, community organizers, leaders, researchers, social workers, public health advocates, and professionals, clinicians, and media. And so we are continuing on with this podcast here. A little bit more about myself. I am a mental health counselor of SIPA, or Search to Involve Filipino Americans. We are a nonprofit based in historic Filipino town. I'm also a community organizer of Sunday Jump, an open mic series, also of the same neighborhood, and a spoken word artist, part of a duo called Steady. And so ultimately, in sharing our stories, I believe in the power of connection and the therapeutic elements of sharing stories of the arts for self-expression and greater social change. And so with that said, I'm also joined by my co-host, none other than Donovan.
Thank you, Eddy. Hello, everybody. Good evening. My name is Donovan Demerin. Born and raised in the Bay Area, currently residing in beautiful Orange County. I'm a member of the Rock Force crew, B-Boy crew, one of the co-founders for the Fil-Good Collective, currently an active DJ, dancer, part-time wannabe rapper, and thank you all for having me.
Perfect. And so with us two as co-hosts, we have here our guest speaker, Dr. Jeannie Celestial. A little bit more about Dr. Celestial, a licensed psychologist and trauma therapist in the San Francisco Bay Area, supporting people in personal and collective transformation. Her lineages descend from Cebu and Cavite, Philippines. Oh, Cavite. My dad's from Cavite. All right. And Dr. Jeannie is an anak, child, kapatid, sibling, kaibigan, friend, magulang, parent, and healer on a journey of decolonization and liberation. So currently, Dr. Celestial is a settler on Ohlone territory in the Bay Area, but I'll go ahead and have Dr. Celestial also introduce herself. Mm-hmm.
Hello, good evening, good day, wherever you are in the world. Yes, my name is Jeannie. I am a daughter of a mom and dad who were immigrants from the Philippines, or maybe you can consider them migrants because their Americanization started long before flying over to Guam, where they settled Tomorrowland in 1965. And I'm a settler here in Northern California, Ohlone territory. And it's such a pleasure to be with you, Donovan and Eddy and the team, to talk about one of my most favorite topics, holistic health and wellness, specifically mental health and wellness. So happy that we can heal together individually and as a community. So thank you.
All right, I'm so excited for the conversation we're about to have. We're gonna dig deep, right, about mental health. Ooh, talk about stigma, talk about healing, all that. Excellent. But yes, before we even begin.
Just want to give a big shout out and thank you to AAPCHO for making this happen. And thank you very much to the Walmart Foundation for their generous support. Thank you, thank you, thank you, thank you.
And so here with episode 3, we have here essentially our cast, right? And we will dive into this journey together with Dr. Jeannie Celestial. And so with that said, let's go ahead and get started. So Dr. Celestial, or Dr. Jeannie, what is mental health and how is mental health impacted by COVID-19?
Yes, a very important question, right? I thought about giving you a textbook answer for what is mental health, but I decided to just give you the answer from my heart. And mental health to me means being at peace and in harmony with yourself, other people, and the world. And for a large majority of Filipinx people, this might also mean being at peace and in harmony with God and one's ancestors. Another way of looking at it is feeling whole and integrated in your body, mind, and spirit. So that to me defines mental health. And when there's disalignment, misalignment, disharmony, lack of peace, then there's distress, dis-ease, disease, right? And then one feels depressed, anxious, lonely, alienated. And I think that's really, that definition kind of epitomizes mental health, especially for Filipino people.
Thank you for touching upon that, like exploring, yeah, like what is peacefulness, what makes you feel whole. And I do appreciate, and I feel that our audience here appreciates your answer coming from the heart, from your own experiences, as opposed to a textbook definition, right? And of course, related to our Filipino community. And so with that said, in terms of mental health and, how is it impacted by COVID-19, considering the wholeness approach, want to dive more into care.
Yeah, so you asked the question earlier of how is mental health impacted by COVID-19, right?
Mm-hmm.
It's like, oh, I feel like the question is, how is it not impacted? COVID-19 and this pandemic, or multiple pandemics that we are living in, social injustice, heightened racist acts, racial violence. These were pandemics that we lived through and survived. And these pandemics affected every domain of our life. Physical, spiritual, relational. It affected our jobs, our schooling, our finances, our society. And so I think as we emerge from this pandemic, and for those of us who survived the virus or are survivors of losing someone in the virus, this pandemic is calling us to reflect and ask ourselves, what are we doing here on this earth? How are we being here? Like, how are you being here? And how am I loving here? Who am I loving here? How am I loving myself? How am I loving others? So again, it's a whole, I'm kind of posing these questions back to folks in relation to self and other, because at the heart of our Filipino-ness is our kapwa-ness, our shared humanity, our shared identity, and seeing ourself in others.
Definitely. Thank you, Dr. Jeannie. And speaking of others, and yes, COVID-19 has been a big test in regards to everyone's mental health, really. Just kind of wanted to see if you could possibly kind of reiterate or go into detail about self-care and community care during the pandemic.
Yeah, so self-care, wow, self-care and community care are very intertwined, right? Because we are truly, our self is tied in our community. And I believe that we also have a responsibility to take care of ourselves. It's like when you are on a plane and the cabin pressure drops, you're on your way to the Philippines or Dubai or wherever you're going in your diasporic journey, and the cabin pressure drops, they say, what do they say? Put on your oxygen mask on first before helping others. Yeah, exactly, Eddie. So I think, bless you, my mom just sneezed. I don't know if you heard that. But so yes, self-care is very important for self-preservation, especially for a lot of us who are artists or caregivers or in healthcare, because we can, even the golden rule for those of us who are spiritual says, love your neighbor as yourself. So there's a underlying premise there that we must love ourselves first, right? Or at least love ourselves as much as we love our neighbor. So in regards to self-care, I would ask folks to reflect on your values. You know, what is important to you in life? Whether it's social justice, community, education, faith, family, love, and use your values as a map to guide you in your daily life, hour by hour. And you know, when I was doing community organizing and kind of volunteerism in the Philippines back in the day, we learned from a Philippine theologian, Dr. Melba Magay, and she asked us to consider, ask yourself not only what is worth dying for, but what in your life is worth living for. So what in your life is worth living for? And so I think we can, as we self-reflect, use those to guide our self-care. You know, if I'm gonna be, one of my values is social justice, then it's imperative that I take care of myself in order to serve the community. And so it's kind of, I don't know if it's too nebulous, I can be more specific if you like.
No, that sounded great. Thank you very much. I mean, it definitely took, you know, just speaking personally, it took a while to find that, you know, starting in the pandemic last March. You know, I know my values, or at least I thought I did. I knew what was important to me, right? But in the weeks, the months, maybe even close to a year of uncertainty, you could get really lost, I feel like. And you know, I totally agree, and I'm so thankful you said all that. But you know, it is hard to kind of find yourself and remind yourself of that, especially when you quote unquote get into survival mode, right? Oh shoot, my job, you know, everything I'm doing is at a halt. You know, let me figure out how I'm gonna get food and toilet paper, you know, and I'm gonna put my values and what's important to me, at least you think, temporarily to the side, right? I mean, so a question I have is just how is that, what is an easy way? And I know as humans, we like to complicate things. You know, we like to just make things so much more complex than they actually are. Maybe it is complex, but maybe some tips that, you know, you know, for those listening, and pretty much for myself, I think that's why I'm asking. But what is a good way to kind of come back to you know, reminding ourselves of our values and our foundation, you know, while we get lost in the uncertainty and the hustle and bustle, and really just trying to see it out of this?
Yeah, that's a good question. There are a number of tools online, and maybe I can share them later on, but really take stock, like even like maybe do it with a buddy or a friend, and just even just for 30 minutes, or even now, like think of the top 3 things that are important to you. You know, for me, it would be like family, faith, community, justice, and healing, just off the top of my head. And then you can use those values as a map. Uh, and this is from acceptance and commitment therapy. Um, the values point me where I want to go. Um, so just say, for instance, with self-care, like you want to be very specific, right? Because when you make specific and measurable and achievable goals, you set yourself up for success rather than being unrealistic, and then you feel like a failure. You're laughing because you didn't do it, right? Like I'll ask folks like, okay, you want to move your body? And they're like, yeah, okay, I'm gonna go on my treadmill every day for 30 minutes. I'm like, well, how many minutes are you doing it now? Oh, 0. And I'm like, you're gonna go 0 to 30 every day for the next week? That's like a bit much, right? So I say, can you do it once or twice a week? Yeah, I can do that. Okay, what day are you gonna do it? Okay, I'll do it Wednesday and Friday at 9 a.m. Okay, 30 minutes. All right, can you listen to a podcast or can you listen to music while you're doing it? Okay, what music are you gonna listen to? So I have them get very, very, very specific. And then also maybe tell a buddy, tell a best friend and text them, hey, I'm about to go on my treadmill. I'm gonna text you in 30 minutes when I'm done. Or I'm gonna text you a picture of the mileage on my treadmill. So like it's helpful, it can be helpful to verbalize your goals and then ask for accountability and reward yourself after, whether it's like literally putting a star on your calendar, and I've done that when I've had fitness goals, to like have a calendar and have stickers and like put a star on it. And then at the end of the month, you see all the stars on the calendar and you feel good. We all love stickers at any age.
Definitely. Thank you, Dr. Jeannie. You brought up a couple things that I kind of want to bounce off of, if you don't mind.
Sure.
One was community care following that, right? But right before, thankfully I started going to therapy a couple months before the pandemic, actually, and the therapist would always kind of, like you said, kind of give me tasks or kind of keep me accountable, because in the day and age of social media, it's easy to, I'm going to post this motivational quote, right? I'm going to talk to my friend and vent to my friend who's not going to disagree with me. I'm going to read a book, and me kind of, being that selfish, I'm like, oh, cool, I get to go to therapy and just vent. And then he's telling me, hey, you have to actually apply and take action in order to get better, And I'm really glad you said that. And I kind of want to move into community care. But I also think, maybe what you said, and you could quote me, or you could correct me if I'm wrong. Let's say, some of our friends, which a lot of them don't, it's all good, aren't going to therapy, whether they don't want to, it may not be, or they're not aware of how to get those kind of services. But maybe we have to, give our friends a call to action, so to say. If they're venting, or if I'm venting, I get it. I like to vent. I like to talk to my friends, but we kind of, in a sense, though we're not professionals, we kind of got to, be therapists and, hold ourselves, but also our close friends accountable. But anyways, before I keep, speaking on that, do you mind going into community care?
Yeah, thank you for your vulnerability and openness and courage to tell us about your therapy journey. I myself think I started seeing a therapist again during the pandemic, and I've utilized therapy at different points in my life. I think it's important to build a community of trust. And that might start with a pet. It might start with a plant. It might start with one friend. Because unfortunately in our community, not everyone can be trusted, or not everyone can be trusted to really bear witness to our trauma, bear witness to our pain, And so something I learned in college from actually a faith-based group that I was a part of was this concentric circle diagram. And I'm going to plug in my laptop because I noticed the battery is going down. So the concentric circle diagram is like you take a piece of paper and you put a dot to symbolize yourself in the middle. And then you draw like the first ring around the center. And then that would be your inner circle. And write down who is in your inner circle. So like for me, it would be like Art and Jody and Cheryl and Judy. And then, so that's my inner circle. And then you can see, then you might want to draw an arrow. Okay, so the arrow inward is like somebody who you feel like very connected to, and like there's this drawing inward, right? But if there's someone you're drifting apart from, they're in your inner circle, but maybe they moved out of state and you haven't talked to them in a while. The state of your relationship, the arrow's going outward. It's kind of like drifting apart. So if I notice, well, like, oh, my best friend who's in Colorado or New York or wherever, we're kind of drifting apart. So maybe I should reach out to them, you know? So identify who's in your inner circle, who's in your second ring, who's in your third ring, and then you can kind of see, who do I want to bring in closer, and who's actually I don't feel super safe with, or feels like a toxic relationship. You might want to like bring them out of your inner circle, like that you don't feel safe with them.
Trim the fat.
Yeah, so I think it's important to just take stock of who are trusted people who can be in your ring of safety.
Copy. Thank you so much for that, Dr. Jean. Thank you.
Yeah, you're welcome.
And so actually, with all the knowledge that you've given thus far, we have some questions from our audience. And so one question we have here, just building off of what you've already shared with us, is are there steps we can take to slowly destigmatize the topic of mental health when we discuss the validity of mental health to our parents and family? I think the thing about stigma, even that alone is hard when you talk about mental health and seen as taboo, as something that we should not talk about, or why are you seeing a therapist, or something wrong with you, right? Yes, please, Dr. Celestial, are there steps we can take?
Yeah, there's multiple steps one can take. Like this podcast, the fact that it exists validates the importance of it, and that we're here talking about its importance is demythifying and demystifying therapy. For Donovan to say that he started seeing somebody, that for me to say I started seeing somebody, it just takes the edge off, you know? It's just like going to the dentist. Like if we only went to the dentist when we had a cavity, then what about the preventative care that your teeth need? I mean, our whole body needs care. And so I use that analogy every day, like that going to a therapist for our emotional health is the same as going to a podiatrist for a foot injury, or going to the dentist to clean our teeth. You don't have to wait till it's severe. You don't have to wait until one is suicidal. You can go when there's mild distress. You can go after the loss of a loved one. You can go when you're trying to make a big decision. There's no shame in going to see a counselor. So that's one way. And
Beautiful.
start it young. Like my daughter knows that I'm a doctor for feelings, and you know, she's 4 years old, and I was pointing at a building, and she goes, "Mama, what's that?" And I said, "Oh, my coworker lives there. Those are condominiums, and my coworker lives there." And she said, "Oh, Mama, is he a doctor for feelings too?" And I said, "Yeah, and he works with kids." And she thought about it for a while. She goes, "Oh, he helps kids with their feelings." And I'm like, "Yeah, exactly." So just starting her at a young age, letting her know that therapists exist.
I love that, doctor for feelings. You know, that's well said. You know, I wish that I had that growing up. And just, you know, like talking about destigmatizing it. I mean, the panel here, this is a first step, just us talking about it, right? Having a conversation that there is key, and to start young. To start young. Like imagine if we had these conversations when we were like, you know, 5, 6, 7, you know. The same way we have conversations, oh, it's important to go to the doctor to get your physical, or, you know, to brush your teeth. But instead of brushing your teeth, oh, we go see a therapist because we, you know, it's important to see a doctor of feelings. I've also seen a therapist too. And, you know, like the same way that I feel that dentists also see dentists, doctors also see doctors. A dentist is not going to work on themselves. that would be wild. But if they could, okay, great. But that would be so difficult. So, you know, therapists see therapists too. Yeah.
Yeah,
But
and can I just say another thing
go
about
ahead.
medication, right?
Oh, go ahead.
Because we have all of these tools available to us for our mental health and wellness, ranging from indigenous practices, religious rituals, and then Western psychotherapy, somatic therapy, dance, art, singing, medications. And, you know, I think the toughest clients I've had in regards to medications, to be honest, have been nurses and psych techs. They are like, you know, because they're like, I am the provider and those are the patients. I can't, you know, they really, there's this huge like barrier. And they're so hard on themselves to take medications themselves. And not only that, there's a lot of pressure from spouses or parents that, you know, basically saying they can't take medication or they shouldn't, and so they have to hide it. And so like what a burden to have to hide that you're taking medicine. So the analogy I use is like if you have asthma, you use the albuterol. You know, if you have diabetes and you need insulin, if you have a heart condition or hypertension, would you not use your medication? If you have cancer, would you not use your chemotherapy? Like, why are we going to deny ourselves from some tools that are available to us to help us?
Yep.
So
You know, I like to look like I have no shame. I'm not shy at all of telling people I go to therapy, you know. Prior to that, it was like, okay, I have a 24-hour super sport membership, a boxing membership. I'm spending all this money on meal prepping, eating healthy. Okay, I'm reading like a book a month, right? Because, oh, we got to read and this and that. And then, you know, I thought about it and I was like, how much am I really investing into my mental health? My physical health, I'm splurging, you know, not even to mention the clothes I'm buying, you know. And then if we don't eat healthy, we're eating, you know, we're eating fancy, or we're eating, you know, gluttonous or whatever. We're spending so much, whether it's healthy or not, physically, you know. So moving, you know, moving forward, you know, I still, you know, have multiple gym memberships, but I have mental health services, you know, or I go to therapy. I read, I go to church. I meditate. I'm just trying to be just all around, you know, as in great shape as I could be. And that's not talking physically, because I definitely got the quarantine 15, you know, but you know, I'm just trying to be in shape, you know, with everything, you know, in general.
Oh, go ahead. Yeah, go
I
ahead.
put in the chat, Donovan, you're a Renaissance person. You're so well-rounded.
No, I'm just all over the place. That's all it is.
You got
Just
a
own it.
full
Just own
toolbox
it.
there. Full toolbox. Yeah. I mean, speaking about you know, like coping skills and like skills and strengths that we can build, and then also going back to Dr. Celestial, you mentioned a couple of barriers. Also wanted to name that with Filipinx AO Americans, studies have shown have some of the highest rates of depression among Asian Americans. And at the same time, they have the lowest rates of seeking help for mental health treatment. And so could you expand a bit more about some of those reasons why that might be happening with barrier?
Yeah, very, very interesting point. And it really hurts my heart to hear those statistics, right? The first thing that comes to mind is, I think, something that's under talked about in our community, which is racialized trauma. And when I say racialized trauma, I think what falls under that umbrella is colonial mentality and the model minority myth and the fallacy of white supremacy. These are very big words, but I think they really touch our community very personally. So your main point of high rates of depression and anxiety. You know, I think that as brown Asians, we are even marginalized amongst Asians. Um, we've also inherited some intergenerational ancestral trauma from Spanish colonization and American imperialism. And the way it plays out in our community is, this drive to kind of prove ourselves to other Asians and white America that we are worthwhile and that we're hardworking. And so we overachieve to the point of sometimes death. And also we might be afraid in the service of survival, as Stephen Porges or Linda Tai would say, in the service of survival, we overwork, and or we're afraid to speak up on the job, and or for real reasons, maybe immigration status, or we're new to the job, or we don't want to get fired. And so there's like some health disparities as to why Filipina nurses in particular bear like a high burden in regards to COVID fatalities. So I think those are some of the factors that lead to the high rates of depression and anxiety. And the second one was what again?
Oh, with regards to help-seeking behaviors, having the lowest rates, getting mental health treatment. Mm-hmm.
Yeah, I mean, we all know about, we in our lived experience, we know, right? Part of that may be the high religiosity. 80% of Filipinos are Catholic. And so we tend to turn to God for support, which is great. But I think it's like pray plus therapy, right? Like I've seen my Black therapist friends, somebody made a shirt that said pray plus therapy, because they also face a similar struggle where problems, emotional distress can sometimes be spiritualized. And I hear it, I've experienced it, I hear it from so many people. Oh, you don't be depressed. You can't be depressed. Just pray and God will heal you. And I would say, yes, and God also helped people invent therapy. And so we can pray and seek therapy. And I think those together probably have the best longitudinal outcomes. So so there's this, and then the stigma about help seeking. And then also, in the service of survival, our people are very resilient to the point of being very long suffering. I think the analogy is something that I witnessed from my parents. They blew a fuse in their bedroom. And so for like months, the electrical outlets didn't work in their bedroom. And I was like, Mom, why don't you call an electrician and get that fixed? It's so annoying. I can't plug in a fan. I can't plug in my computer. And she goes, oh, anak, in the Philippines, we didn't even have electricity when I was growing up. I studied with a kerosene lamp. And then, I was like, okay, well, she has a point, it doesn't bother her, it bothers me. So she's more long suffering than I am. And so that is a definition of resiliency. And can we get help before it's severe? In our clinic, I work for an HMO, a large healthcare organization in Northern California. In our teen clinic, in our child and family department, there's high rates of Filipino teens that show up. They're already suicidal. They're either having serious thoughts of self-harm or they've attempted. And one of my Latina colleagues said, why are they showing up so late? And there are different factors for that. One is denial, that the parents are not seeing or choosing not to see that their child is suffering. Maybe they've prayed a little too long before seeking help, and or the kids felt ashamed and didn't speak up about it. And so, we don't have to wait until we're suicidal to get help. Let's seek help before that, before it's too late.
definitely in terms of receiving help, being okay with asking for help. Thank you for touching upon not only at the individual level when it comes to awareness, but also at the systems level, like for example, the impact of colonization and the result of colonized mentality, talking about immigration and issues with insurance could even like, be lodged into that. But all that coming into play and could then lead to, some of the lowest rates of seeking help for mental health treatment, unfortunately. But again, it goes back to destigmatizing, which is a huge one, by talking about it and by sharing resources. And so thank you for getting that information out here for our audience here.
And Dr. Jeannie, you brought up a few things. One, most of us being raised Catholic, just saying, oh, just pray and knock, stuff like that, that we're used to. How would you say mental health is actually perceived in the Filipino culture, whether that's from childhood, adulthood, and
Yeah, so you mean in like just the traditional Filipino culture?
Mm-hmm. Yep.
Yeah, so traditionally, I don't think they have a category for a psychotherapist. Traditionally, if you're in the, province, you would sort out your feelings with like your yaya or your auntie or your cousins. You might pray about it, might talk to your friends. So this concept of psychotherapy is so foreign. And, living in 2021, even the Philippines now, there's a growing movement of psychotherapists in the Philippines. So we can draw from tools from both cultures. A Latina psychologist, Dr. Comas Diaz, talks about we need to be bilingual in our approaches to mental health. And that means drawing from our cultural and traditional and indigenous tools, as well as our Western and our American tools. And why not? We have these tools at our disposal, or as Resma Menakem says, these toys at our disposal, these things that can bring us joy and laughter and peace. So not just tools, but toys. And you as a dancer, as an artist, there's so many tools that we can use really to heal and reset our nervous system. Because especially in the world that we're immersed in with chronic racial trauma, we have to reset our nervous system multiple times a day. And that might be through deep breathing, just moments of mindfulness, even taking an eye break. Like I'm staring out the window, looking at the blue sky right now. I'm trying to talk to my plants and be around living things, petting your dog or cat, gardening and really touching dirt, taking walks, stretching. So resetting our nervous system multiple times a day. And that has cumulative effects in helping us manage stress and trauma. Looks like there's another question.
Thank you for that, Dr. Jeannie.
Mm-hmm.
Thank you.
Yes, looking here. So talking about generations of culturation. So do you see any changes generationally and in the inculturation/acculturation levels in the Fil-Am community in terms of how therapy is perceived?
Yes. The answer is yes.
Yes, we got it.
We just, my two colleagues, Jane Alfonso and Dr. Claire Reclosado Bacle, we did a case consultation in our clinic on Tuesday. And I had folks of all different ethnic groups, therapists, type in the chat how many Filipino clients they're seeing. Some people said 10 to 12, some people said 3, some people said 15. I mean, there are so many Filipinx folks seeking therapy. I myself, I have young people as young as 18. I see adults 18. I have some folks who are like 74, 68. There's such a wide range of different generations of folks seeking therapy now, and it's awesome. I have never seen this many Filipinos seeking therapy before. And in my clinic, we have like one MFT, two psychologists, two psychiatric nurses, one Filipino psychiatrist, just in the Napa Solano area. So there's so many more Filipinos, Filipinx people entering mental health as a profession, which is also wonderful. So I think that that really goes to show that our generation and is seeing so many more mental health consumers and mental health providers. So I'm so excited. We are in a very exciting time.
So there is that progress, and I'm so happy to hear that you're seeing that in the field up close. You're speaking to family members. You mentioned, all across the lifespan there. And for me myself, I'm a mental health counselor too. I primarily serve Filipino families. So think about the household and all the generations are there. I wanted to ask you, Dr. Celestial, like how can we support an individual's mental health during this time from all the different generations, the Lolos, the Lolas, the grandparents, right? The parents to grandchildren. How can we support?
Yeah, that's a good question. I thought about this. I think there are many like therapy tools and models, and it behooves us to contextualize them to the Filipino culture. So say, for instance, the 5 love languages, which I actually really like. I don't know if you've heard of them.
Yeah, I've heard of those. Yeah.
Yeah, if you go
quality
to
time. I like quality time.
yes, exactly right. So if you go to 5lovelanguages.com, you and your loved ones, whether it's your romantic partner, your parents, your kids, whatever, you can like take this 5 to 10 minute quiz and find out what is your primary love language, which are like acts of service, quality time, words of affirmation, physical touch, or gifts, right? So like say as a culture, Filipinos are very prone to like acts of service. Like my mom shows me she loves me by cooking me adobo or doing my laundry. She's, she can still do or hemming my pants because I love it when she hems my pants. But that's how she shows me she loves me. But if my love language is like words of affirmation, like I might need to say, hey mom, I just got a new job, or I just graduated, and can you tell me congratulations? Can you tell me you're proud of me? Because I would like to hear that. So I think it's important to maybe learn about yourself, like what are your love languages and what are your family's love languages, like your Lola's love language might be different from your dad's, but also you can communicate like what your needs are, to your family members so that they can learn your love language too.
Talking about love, right? To love yourself, to love each other. I'm reminded also of this phrase of walang hiya, like without shame. I know that sometimes it has a like a negative connotation, and there's been a movement to reclaim walang hiya, whereas be like, oh, let's live life shamelessly, without shame, and let's love each other radically. So with the love languages, let's please continue to do that. As we explore what does mental health look like to take care of ourselves and of each other, the self-care and community care. But it all starts with love, yeah.
Oh.
Yeah. And so I wanted to actually highlight some of so we have more questions because with all of the knowledge that you are giving, people are more and more interested. And so we have a question here about, interventions. Okay, so what are the most effective interventions you use in therapy when treating Fil-Ams?
Good question. It depends on what type of Fil-Am, right? Is it like a highly acculturated more Americanized Fil-Am, or is it an older Filipino immigrant parent? For my older generation folks, I tend to do a lot of listening. There's this thing called narrative therapy, and they just like to talk. They like to reminisce. There is even a thing called reminiscence therapy, that talking about the good old days is actually healing. So I spend a lot of time just listening to them talking about the good old days or the things they miss, because relishing good times actually can elicit good feelings. And then I use a lot of humor, like even calling out old people on their stuff. I use humor, and they kind of like it that way. And for my younger folks, I think using a lot of validation, using a lot of psychoeducation, bringing awareness to Filipino dynamics and how they're playing out it's playing out in their life, especially when it comes to dysfunctional family dynamics or family strife, discord. Lately, I've been using a lot of EMDR and somatic work, which is a type of trauma therapy that integrates the left and right hemisphere of the brain, so as to help folks feel a lot stronger internally and process difficult emotions and feelings and experiences and memories. Though that's been very effective, especially in treating folks with racialized trauma, decolonization, things like that. And a lot of affirmation. And Donovan, you have a question?
Oh, no, go ahead.
Really helping folks, one, debunk their negative beliefs about themselves, and also begin to accept and integrate the positive beliefs about themselves and their worthiness, their lovability, their worthwhileness, hope and joy. One concept that came to me during the pandemic was dalawang buslo, two baskets. And I imagined like our ancestor, a beloved ancestor, coming to us saying, let me help you hold this difficult time, this pandemic. And so I imagined it as two baskets, and one basket is all the challenges of this pandemic, this time. And then in the other basket, things we're grateful for. And I think those need to coexist, and both have honor as we try to integrate the past year and a half.
Awesome. Thank you, Dr. Jeannie. And I know you've given us a lot of knowledge. AKA, thanks for all the game. You gamed us up and gave us some resources. And just in case more people do want to take action, and maybe hopefully after this podcast want to get started on improving their mental health, or at least exploring it. Do you know any COVID-19 mental health support groups that maybe we could list and let people know about?
Yeah, definitely Fil-CHA, thank you for all you're doing with this podcast, and just in general in terms of organizing all of the scholars, activists, and practitioners around the country. Asian Mental Health Collective is a group on Facebook and other venues, other social media. I have been studying the works of Resmaa Menakem, who's a Black trauma therapist and best-selling author who talks about healing our minds and bodies of the vestiges of the fallacy of white supremacy. I'm adding the fallacy because I'm underscoring that it's not real. It's a social construction. FMHI, Filipino Mental Health Initiative, there's a number of them in Northern California, San Francisco, Solano County, and San Mateo, as well as the Tatlong Baksak movement. And it's an anti-racist movement that you can learn there's a toolkit, a free toolkit for how you can talk to your family about anti-Black racism, which is a very hard topic to bring up to some Filipinos, but they provide a toolkit where you can learn how to have these difficult conversations. You can find me on sessionsync.com. The Asian American Psych Association, we have a division on Filipinx Americans. So those are just some tools, and the Fil-CHA folks were kind enough to pop in some of those links in the chat, and we'll be posting it on social media, I'm sure.
So Dr. Celestial with that game, like as Donovan mentioned, so I hope that folks are taking notes. I am definitely taking notes as well too. I feel that, it's impossible to know everything. And I believe that, we're all learners and we learn something new every day. So encourage you all to continue to seek out and, to be open to learn and to grow with that knowledge. And Dr. Celestial, with all of the knowledge that you dropped today, and all the answers, all the questions that you've answered, are there any last comments you'd like to make?
I do want to say a few comments. One is I want to speak to the parents out there, particularly the immigrant parents. I want to say thank you for all your hard work and sacrifices, in the service of survival. You have really given it your all and worked so hard to get where you are today. At the same time, I would please ask you to ease up on your kids, spend quality time with them, tell them you love them, quite literally try saying, "Anak, I love you. I'm so proud of you for pursuing your passions." And I ask you to please celebrate who they are as individuals and refrain from comparing them to others, as it really hurts their feelings, and try to accept them as they are. And so that is my request, my invitation to the parents out there. And I do want to say that in terms of mental health, that you matter, and that taking care and tending to your mind and body is so important. And so please do that, and please avail of all the resources available to you. And also I want to say that our community matters. And so let's continue to work together, love one another, and work through hard stuff, resolve conflict, reconcile broken relationships when possible and when safe to do so. I really want to say, follow your passions, that even though you may get pushback from your parents, in some ways you pursuing your passion, following your vision, is actually making the ancestors proud, and actually fulfilling why your parents came here in the first place, right? And so we can also rest. We can also claim radical rest in ways that our ancestors, our parents could not. And so that is radical. That is healing. And so let's do that without shame. But also with love and respect for ourselves and our family. So those are some things I would love to leave folks with, as well as, and Donovan, Eddy, any folks on the chat, you're willing to join me in thinking about what's one value and one action step you want to take. And so I will type it in the chat and fill in the blank, in the service of blank, so name a value, I will blank, name a committed action. So I might say, in the service of health and justice, I will speak on one podcast a month, or some might say, in the service of wellness, I will take one walk at the marina, take a walk at the marina once a week. So, just thinking about start with something small, start with something realistic, but think about what's one value and one action step you want to take after listening to this podcast.
Thank you so much, Dr. Celestial. So yes, encourage you all to please take this as a homework I don't want to say home. It's more like life work, life work. So yes, in the service of your value, what will you do moving forward? Again, thank you, Dr. Celestial, with all the knowledge that you dropped on us today, talking about affirmations, talking about the importance of celebration and following your dreams, your goals, and having not only radical love, but radical rest. I like that. I haven't heard that before. Radical rest. Yes, let's all have a time to rest and to recharge and to move forward. And so thinking about mental health and self-care and community care, thank you all for joining. I encourage you all to please take what notes you've learned today and please share it. Please share it. Resources are meant to be shared. And so this year we'll close out our episode 3, and please stay tuned for episode 4, which will cover Philippine XAO healthcare workers COVID-19 experience. So that there will be on Wednesday, June 16th after 5 p.m. Okay, after 5 p.m. So just save those time slots, just save after 5 p.m. Okay, Wednesday, June 16th, episode 4. And so I want to say thank you again to Dr. Celestial. Thank you to everyone that has tuned in. Please follow us, Fil-CHA, on social media. It is at FILXAO_CHA, Fil-CHA. And you can also like us on Facebook. Let's stay connected. Let's continue to build. And also, yeah. Oh, go ahead, Donovan.
Donovan, thank you, Eddy. It was a pleasure being with you, siblings, kapatid. Thank you all who tuned in and who are going to listen. And feel free to share your stories with me. You can find me on Instagram at Jeannie Celestial. And share your wins with me. I'd love to hear about them.
Thank you all. Thank you, Fil-CHA. Thank you, Eddy. Thank you, Dr. Jeannie. Everyone for having me. It's been awesome.
707, yay.
I don't know which way, if I'm mirrored or whatnot, but at Donovan
LA.
at Donovan_707. That is my random Instagram.
Stay connected. Please stay connected with Donovan. Please stay connected with Dr. Celestial. You can also follow me at Right Steady. Let's all stay connected. All right.
Peace, love, and blessings.
Take care, y'all.